Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, a lot of people are getting their second shots, which thrills me, and a lot of people are getting their first shots as well. But after that second one, it seems to kick in some kind of immune response, and people are sick. What exactly is happening to our body after that second shot?
Well, that's actually a good thing that that's happening, but it is, it is kind of irritating while it's going on. But so what's happening is the first dose is priming your immune system. And then when you get the second dose, it is actually creating the immune response. So a lot of times people during their first shot will get a sore arm. Some people get a rash around the site or whatever. All of that's normal and that's fine. And then when the second dose, people have that, you can have a fever, body aches, a headache, chills, and that lasts for usually under 48 hours. Mine lasted about 18 hours. But I've known people older than me, younger than me, who got the same dose type as me and the other dose type. And it's been all over the place. So there doesn't really necessarily seem to be any rhyme or reason to who gets the stronger immune response. But it is not considered a reaction. It is just a normal side effect of the vaccine. And that will subside within, usually definitely by 2 days.
I haven't spoken to a single person who had a reaction who regretted getting the vaccine, though.
Absolutely not, because that gives you a little taste of what it would be like to, have COVID. And some people have a very, obviously, really serious response. And sometimes it's the individual's immune response that's actually causing the problems and getting them hospitalized. So, you don't want to risk getting the virus when you can just get the vaccine and have a much less of a problem.
Public Health has done such an amazing job of updating on Facebook, on your website, of who gets the vaccine when. Since we spoke last week, it was 40 and up with pre-existing conditions. Has that changed?
Yeah, technically right now we're doing what's called 1B plus. So that is the 16 and up. It can be 18 and up depending on the vaccine, but with underlying health conditions. So that is open to everyone. The only problem is none of us, we don't have any at Public Health. Carl doesn't have any. We don't have any first dose appointments right now. But we are encouraging people to check the Walgreens. A lot of Walgreens in our area, in our county, Mahomet, Rantoul, and a bunch in Champaign have it, and they are providing doses. So, while you're waiting for us to get our vaccine back for first doses, go ahead and try to get on the Walgreens app for your first dose.
Well, we're speaking of vaccinations. There was a walk-in clinic last weekend. Mm-hmm. I was envisioning a full parking lot and organized chaos. How was it?
Well, I wasn't actually there. Carl was running this site, and I heard that it went really well. They gave right around 200 doses, which is how many they had. And it went really well. As soon as they had all those, people lined up for all those spots, then they closed it so that people weren't, standing around for nothing. But apparently it went really well. And as we move into the middle and end of March and moving forward, what's going to happen are, places like Christie and Carl and OSF and different places, Francis Nelson, they'll still be doing vaccines either at their locations and or having clinic sites. And what Public Health will be doing is a lot more community-based vaccination sites. So we'll be doing more outreach. And we've already done a lot of outreach. We've been into the jails. We've been into, we're going into senior housing. We're going to have a lot of different special clinics and neighborhood clinics and trying to make sure that we get equitable distribution throughout our county.
Before I ask the next question about where we are with numbers, even though our numbers are on the decline and we are in much better shape than we were a few months ago, everybody that is hospitalized or recovered, there's still somebody's family member. There's somebody, even though we're lower, I just want to remind people that our numbers are low and we're all sick of being stuck inside, but there are still people out there that are fighting us.
Yeah, we have right now 13 hospitalized just from Champaign County alone. And, to be hospitalized with COVID, that's a pretty serious case. So, and we're up to 128 deaths now. So yeah, these are people who have family and friends, and it's still a very serious disease. And the important thing to know is the vaccine is here, and we're getting more and more and more of it. So we really need to double down and take precautions, because it's horrible enough to lose somebody to COVID, but it's even worse when it's happening while we're getting people vaccinated. So we really urge people to take it seriously and get the vaccine as soon as you're eligible.
The variant was starting to scare me until I read encouraging articles this weekend, according to the New England Journal of Medicine, that it's possible that Pfizer and Moderna both have a high efficacy rate against that variant. Is that true? Have you heard those statistics?
Yeah, the variants that they have discovered so far, the vaccines are working for that. Of course, the concern is that it keeps spreading and spreading and spreading until we get some type of variant that is not effective or makes the vaccine not effective. So again, that's why it's important to continue doing the things you need to do: the masking, the distancing, the hand washing, and to get vaccinated as soon as possible.
Our numbers are lower than they have been since November 13th right now in terms of hospitalizations. Is that due to vaccinations? Is that because we are doing a good job of social distancing, hand washing, or all of the above?
Well, we had a really high number of cases, hospitalizations, and deaths through the winter months, which was kind of to be expected. Well, it was to be expected, but so we're kind of out of that area. But yes, people, in our county have been doing a good job with the prevention measures. And, our state went on different mitigation tier, and that helped to, tamp down the cases as well. So now we have a combination of things going on. We have people with immunity, at least, for the first 3 months after infection. We have people who are getting vaccinated. We have people still doing the things that they need to do to protect themselves and others. So, you put all those things together and they really do work. And I really hope that we just keep seeing the cases go lower and lower and lower and lower until it's not really an issue. And then once we get back to having, very few cases, it'll be a lot easier, to contain those. But it's always difficult when you have cases that you don't know are out there. So we are still asking people to get tested even after vaccination if they think that they've been exposed. So wait 5 days and get tested, whether you have symptoms or not.
And even if you've recovered, or even if you had a mild case of it and you were asymptomatic, there's something called post-COVID syndrome that people months later still complain of being bone tired and don't have any sense of smell or taste or foggy thoughts. So are there studies being done right now because of these long-term effects?
Yeah, I mean, they're looking at all the different long-term effects and what's causing them, and probably trying to figure out how to treat some of them. But again, it's just another reason why you don't want to get this virus at all. People are using the death count, the mortality rate, as saying it's not very high. Well, it is very high. We've had 500,000 people in the US die in the last year from this. That is an astonishing number. And I don't know why people aren't understanding how bad that is, but that is with the mitigation and the different things that we've done. So it's a very serious disease. And, we just have to keep doing the things that we need to do to keep it as low as possible, and keep saying it, but get vaccinated as soon as you're eligible.
One more question about vaccinating. Some people are allegedly line jumping and other people are anxious, and there's a lot of competition out there of getting the slots. What is your advice to those people who are anxious or just waiting their turn for the vaccine?
Well, so we're in a pretty good place right now where anyone with basically 18 and older with any type of underlying health condition can get vaccinated. So if you can get in to get it, don't wait for, your job. Don't wait for, a lot of people think that they're perfectly healthy when essentially they still may be qualifying. Obesity is something that qualifies you. If you're 18 and older and you're obese, again, that's 30, it's a BMI of 30 or higher. That's not that's not that high. So people need to look at that. If they have various illnesses like COPD or breathing type of issues, if they have any type of heart disease, high blood pressure, that type of thing, try to get in there and get it, especially right now with Walgreens having all the slots open. We hope that people will get in there and get it. But I think some people are trying to overthink this. What we did in our county, which is, I'm glad we did it this way, but we started with the highest risk and then we start working our way down. So people don't need to worry about that they're jumping in line and taking someone else's vaccine, because we are, actively working as a community to make sure everybody that's at risk is getting it first. We've been doing that since December, basically. So we're kind of now to a point where anybody who fits into 1A or 1B and 1B plus can get vaccinated, and that will take care of a lot of people in our community.
And once everyone who wants a vaccine gets a vaccine, Dr. Fauci still maintains it will likely be into 2022 that we're still wearing masks. Is that something that you see down the road, that even though we're going to have really good immunity in our community, keep masking and social distancing as much as possible?
Well, I think when you're in public, definitely, because we're not going to know who's vaccinated and who's not. So again, the person that's wearing the mask, assuming that they're vaccinated, they're protected, but until they know for sure whether we can have a asymptomatic or pre-symptomatic case that we're spreading, we need to go ahead and keep wearing the masks. I think we'll be seeing them on airplanes and in airports and in public transport and places like that. But it will be, if your whole entire family is vaccinated, even your extended family, you'll be able to get around each other if you're all vaccinated. But in public, I think that for quite a while, we're going to be needing to wear masks because we don't know who's going to be vaccinated and who isn't.
Before I let you go, you mentioned Walgreens is the best shot right now. I didn't mean to use that pun. Your best chance of getting a shot?
Well, certainly for the next 2 weeks, we're doing a lot of second dose clinics in our community, and we didn't get much vaccine. The Walgreens, there are other places to do it, but in our county right now, it's only Walgreens, and it's only certain ones. But they do have a thing online where you can get on there and sign up, and then you can be notified when one is available, or you may be able to get an appointment right away. So, we're urging people to look at. We don't have appointments available, so you definitely use Walgreens, and those are going to be available moving forward. So Walgreens will be and later CVS and other places will be getting the vaccine from the federal government. So it's not like taking up local doses, if you will, but it's definitely going to help out. So just get it where you can get it, assuming that it's in our county. We don't want people going out and using other people's resources in other counties, because a lot of them are struggling because they haven't gotten that much vaccine.
I've seen the online
pharmacies, I do want to be clear, they're available for anyone. So pharmacies are a federal vaccine, so anyone can go anywhere to get them if you can get in there.
And anyone can watch this show. See what I did there with the transition on, of course, UPTV. Jason Liggett, you're our amazing producer, and we wouldn't do this without you. Literally, we don't know how to operate the electronics. I want to thank Urbana Mayor Diane Marlin. She's always our biggest supporter in this endeavor. Julie Pryde, what would we do without you? And the entire CUPHD, thank you so much for your time today.